welcome to episode 53 of the Dental Realist Podcast. I am Dr. Ryder Waldron. I'm here as usual with Dr. Troy Stevens and Dr. Marcus D. Neff. Troy, how's it going tonight?
It's going really well. Just kind of trying to survive the week. You know, I worked 3 days this week, and that was about enough.
That's a killer. Glad you could tough it out. Marcus, how are you doing?
I'm doing all right. It's been an interesting week, but it came to a close, and so I'm on to my weekend after tonight.
Good. So we have a very special guest tonight, probably our most special guest that we've ever had tonight, I would say. We are joined by Howard Trotter. He is a 1974 graduate of Creighton University School of Dentistry. After that, he practiced general dentistry for 42 years before retiring a few years ago. And he's also my father-in-law and just an all-around good dude. So Howard, welcome to the Dental Realist Podcast.
Well, I'm really, I don't know what to say.
He's thrilled to be here.
I am thrilled to be here. I can tell I'm in good company.
Yeah,
with you
we're going to have a great time tonight. So Howard, first of all, why don't you tell us? Oh, go ahead, Marcus.
I just said we're honored to have you on the podcast.
Yeah, that's right. So Howard, why don't you first tell us what made you interested in a career in dentistry so long ago?
Well, probably like you guys, to start off with, I wasn't really dead set on being a dentist, but what really got me thinking about it seriously was my first girlfriend's father, who thought her daughter was possibly going to marry a poor farmer or a poor miner. So he sat me down one time and said, "Howard, what do you think you want to do?" And I said, "I don't really know." He said, "Well, let me give you a hint." He said, "My uncle is a dentist, and this guy lives in Seattle, and he has a lifestyle you would not believe. He hunts and fishes. He has a boat. He comes and goes. He's his own boss." And he said, "I think you ought to be looking at being a dentist." So I went to Utah State and registered in pre-dentistry.
Awesome.
And the first time I took the DAT, I didn't do so well. So I applied my first year. That was 73. Wow. I got on the alternate list at Northwestern, and that was not where I wanted to go. So the following year, I reapplied and got accepted at Creighton.
Cool.
So that's where we went.
Cool.
Omaha. I take that over to Chicago 10-1.
Yeah. I think. We just lost all of our Chicago listeners with that comment, but we'll be just fine. No, I'm just kidding.
Sorry about that.
No, that's.
I think that's interesting, Howard. You know, I think that for me, that was one of the things that attracted me to dentistry was the idea that I saw my dentist, and the guy drove a nice car. He seemed to work some nice hours. I started looking at it going, I grew up on a small farm, and I know my dad works really hard. Maybe this is a better life.
I had some really terrible jobs as a high school kid and a college kid. I worked in a mine in the summers. My dad was a miner, and I knew darn well I didn't want to be a miner.
Yeah.
And I worked on the farms, drove tractors, picked fruit, hoed beans, hoed everything, beets and whatever else.
Man.
So
what kind of mine did your dad work in, Howard?
It was a mine that was, what the heck was it? It was a catalyst for the oil refining business. All the other mines up around Eureka, Utah, where we lived close by, were silver mines, but that particular mine was not. The one I worked in was silver.
Wow.
Awesome.
Anyway, it was good to get out of that atmosphere and go to dental school, tough as it was.
Yeah.
So you entered dental school, did you say in 73, 74?
No, I went in at 70 and got out at 74. Spent 4 years in Omaha, Nebraska.
Now a lot of our listeners are probably, either just going into dental school or went in around the same time as us, 2000s. Tell me what was tuition like back in the day when you went? What were you paying a semester or a year? Or?
Can't give you any specific dollar amounts, but it was dirt cheap compared to what it is now. We got health profession loans, and some other loans, and we worked. We had our own painting company. We
Wow.
worked all summer, and during the school year, we worked part-time as painters, and I knew I didn't want to do that. but as far as tuition and the costs, Creighton was very good to help us, and it wasn't a real issue as far as I was concerned. Everyone has to pay their debts when they get out.
Yeah.
But anyway, it was doable, and I wouldn't take what they're paying these days. It's pretty tough.
I think 350 or 400,000 is going right. I think I asked you one time, Howard, how long it took you to pay off your student loans. And I think you said, it took a while. I think it took about 7 years or something like that.
That was priority number one.
Yeah, that's great. That's great.
I was just always afraid of debt,
Yeah.
and still am.
Yeah.
And we got out of it pretty soon. That was my number one goal.
Yeah, that's awesome.
Put every penny I could against those health professional loans, which were low interest.
Yeah.
And, all the other debts that we had weren't too significant. So I think it was about 7 years. And
Yeah, that's awesome.
that's a great feeling. I would recommend anyone that's indebted to make that a priority to get out of debt.
Yeah,
It takes the stress out of life.
That's great.
Considerable.
Yeah, absolutely.
Yeah, I know it's been a long time, Howard, but what is the hardest thing you think you had to do as a dental student? Do you remember what kind of drove you to the brink?
There were a lot of things, but I think the toughest thing was convincing myself that I was as good as these guys on either side of me, in front and back of me.
Yeah.
I don't know if it was
That's
an
interesting.
inferiority complex or whatever, but once I got it in my head that I was as good as these other guys, it became a lot easier. I think the hardest class was anatomy, gross anatomy. Once I got through that, it seemed to be a little easier. Once we got in the clinic,
Yeah.
I actually found the clinic easier than the classroom.
I think we'd probably say that too. The three of us were in a gross anatomy. I don't know. We were in the gross anatomy lab together with another guy, and it wasn't our favorite class. The guy that we were in that we were dissecting the body with, he loved to just dive in and cut all kinds of stuff. And I remember the three of us were like, we didn't love that. Would that be fair to say, guys? The gross anatomy was not our favorite class.
Yeah, it was very gross.
Yeah. And I think that's a good point, the inferiority thing, because I remember feeling the same way. Like, I'm not sure I even belong being in dental school sometimes. And I'd look at some of the preps I'd cut in those plastic teeth. I think, good heck, I think like a blind guy could have done that. But I don't know. So that's interesting to be the hardest thing. Yeah. I'm going to go off the list of questions here, but what was the biggest change that you've seen from when you started dentistry in 1974 until you retired in 2016, I believe? Like, what was it? Was there any like seismic shift, whether it was wearing gloves or lights on the hand pieces or anything like that? What was the biggest
It was
thing?
the increases in the advances in technology. Back in our day, it was all amalgams mostly.
Yeah.
And they did a good job, and we were good at
Still
it. They
do.
taught us well.
Yeah.
Composites came along, and light cured composites were probably the biggest thing that changed the way I practiced. The fact that you could put a restoration in it, and it would harden when you
wanted it to.
When it wanted to.
Yeah.
The old two mixed composites, they were tough.
I don't think we'd ever use those. Did we, guys? I don't remember any two mixed
No.
composites.
I remember the compules that we've always kind of had, and since then there've been little changes in composites and some advancements. But yeah, that's probably true.
That impression material we used, what was it, hydrocolloid?
Colloid, yeah. I
You
wonder
had to
if
mix
Howard
it up
ever
and
did
then
that.
run water through a tray. Did you ever use that?
Quite a bit early on. Yeah, that was interesting and fun to work with.
Yeah.
Yeah, I remember that. And didn't we have like in a hot water bath and you put it in the tray and then run the cold water through it? Is that what you guys did? Yeah, that was, we didn't use that on patients, but in the lab, yeah.
Made some great impressions.
Yeah, it did.
To work with.
It did seem that way. The other day, I got to throw in a plug for amalgams. I had a guy come in, he had 31 broken off, had just the buccal cusps. And in front of that, he had on 30, he had like a 5 surface amalgam bonded in there. And it's probably 40 years old. And I thought maybe I should call Howard and see if he can do the same thing on this 31, because I told the guy he probably needs a crown. He said, well, let's try a filling. I thought, good crap, how am I going to get a filling to stay in there? Because I know composite's not going to bond in there real well. So I bonded in a big amalgam, and we'll see how it lasts. But some of those old amalgams, guys, guys have probably seen them. They last forever.
Absolutely.
And
Yeah.
I don't remember learning to do amalgams that well.
I've got a mouthful of them myself, and I wouldn't trade many of them for two surface composites, to be honest.
Yeah, I've got some that have been in there for 30 years on 30 and 31, and they still seem to be functioning just fine.
A lot of the new materials are great, but a lot of the older ones are great as well.
Yeah.
Gold crowns. I was always a big fan of gold crowns, particularly on second molars.
Yep.
Where aesthetics are not a factor.
Yeah. I tell people I'd put gold crowns on the anteriors if I could, because they work so dang well. I love it. They always fit. You don't have to adjust much, and yeah, they're great.
Another fun thing about gold crowns, when you extract them, you can always put that gold down and make your wife jewelry.
That's what I did in dental school. When I took all the gold out of the dentiform that we used, I actually actually, you guys might have done it too. We melted our gold nuggets down, and we made our wives rings.
Yeah, I didn't have a wife.
Did you guys do that?
No, I didn't have a wife or a girlfriend.
Oh yeah, at the time you didn't, right? Yes.
Yeah. Howard sold me his practice and then let me marry his daughter, so I'm eternally indebted.
Deal.
Yeah,
it's a great deal.
Good deal for everybody.
Yeah, very good.
When I first started in private practice, I tried doing a lot of everything. I mean, I just tried to do everything I could. And one of the things I found that I just did not enjoy was taking out wisdom teeth or difficult extractions generally. So is there something that you started out your career and you thought, I'm gonna do that, that's gonna be part of what I offer my patients, that at some point you said, you know what, this just isn't worth it anymore, I'm not doing that?
I would agree with you. Oral surgery, they had a really great program at Creighton, and we were well educated in doing it. And I was okay with it, but it was stressful and I didn't really care for it. So the oral surgery part of it, and endo was another part that we weren't really well trained on. Back in the day, they were still teaching silver point endo, and we got the end of that.
Yeah.
I think I got out of Creighton with one molar under my belt.
I think that's probably about the same with us guys, and one or two molars maybe. And we've talked about this a lot, those silver points. I still see some of those. I see some of those out the apex. I see them 3 or 4 millimeters short, but those suckers, they never have to be retreated, it seems like. I don't know. It's amazing.
They seem to last forever.
Yeah.
They were quick and easy.
Were they? Yeah. I mean,
some of them, if they blew up, they were very explosive.
Troy, do you have another question for Howard?
Well, I was just going to say, on the other hand, we talked about things maybe you didn't like to do. What would you say was the most rewarding procedure, something that you really enjoyed doing?
That's a pretty tough question to answer, but I really got a lot of enjoyment out of doing crown and bridge. You do some good aesthetic crowns and see the before and after pictures. And to me, I would say that was probably the best. Maybe young girls that came in and wanted their anteriors to look nice, and we were lucky enough to have a good lab and had good success with crown and bridge. So to me, I think that was probably the best procedure as far as feeling good about it.
Yeah, that's a good one. I want to know more about gold foil, because I think you told me one time, Howard, that gold foil probably caused more root canals than it prevented, because you had to heat that stuff up so hot or something like that. Is that true? We didn't learn how to do gold foil.
We spent a lot of time learning gold foils, and it was very technique sensitive, but they look good. Yeah. But the fact that you'd put hot gold in it and tap it in with a hammer and then spend an hour buffing it, heating it up to get it shiny. And
wow.
Impressive.
I think our class was the last year that had gold foils on the state boards. Okay. I'm lucky I passed, because my patient had a class 5. I had a real tough time finding a lesion.
Oh wow.
But this gal had some of the worst perio I've ever seen, and it was a class 5. a challenge, to say
That's
the
a good
least,
one.
to get that foil in.
That's good.
That was the last one I did, was my board.
Oh,
Thank
really?
goodness.
You didn't ever do any in
I
private
never did
practice?
another
Okay.
foil.
Wow.
And I
Okay.
spent 3 years learning how to
Learning how to
do
do them. That's great.
them.
That's hilarious.
They had gold foil clinics. People from all over the country that were Creighton graduates would come back, and boy, they were revered. They
Really?
really loved their foils.
Oh my gosh. I still see some of them that are still in there, but I think about that every time I see one, how, this sucker's been heated up to the temperature of the sun. They were adorable. They are, man. That gold lasts forever. Go ahead, Mark. You've got a question.
Howard, when you started out as a rookie, just like we all have to, a new dentist, but as you moved along through your career and you maybe interacted with other new dentists that were coming up, what were some of the common mistakes, or were there mistakes that you saw new dentists kind of keep making as they entered the profession? Or is there something you'd say to new dentists that they definitely ought to do, or definitely ought to avoid?
Well, I think the biggest problem that we had was overdoing specialty treatments. Like I said, we weren't overly expertise in endo, and that was something that we attempted that we probably shouldn't have. And the fact that, that the bank loans over your head, so you're thinking, maybe I'll tackle this one, and then an hour later you're thinking, why the heck did I tackle that one? So I would say, just to anyone that's getting into it, stay within your comfort zone and pick your areas of interest, and focus on those. Don't try to spread yourself too thin.
Yeah, that's great. And I think you guys probably felt the same when we got out of school. It felt like we were supposed to do every endo, take out, like you said, Marcus, wisdom teeth, everything. And I think once I started talking to Howard, and I thought, oh, he refers out pretty much all molar endo, all surgical extractions and stuff like that. I thought, okay, like that, I like that. There's not pressure to do that. And I see a lot of general dentists doing stuff like that, and it can be a headache. And yeah, you cut into that wrong tooth, and it's like, good heck, why did I even start this? And then, your malpractice will tell you all the time that once you've touched that tooth, you own that tooth. So better judgment in what cases you take on, I think.
Sure.
Just pick your areas of interest and focus on what you like, not necessarily what you're good at, but what you like more than anything, and then get the training to be great at what you like.
Yeah, that's good. If you like it, you'll probably be a little more passionate about learning about it. Yeah.
Looking back, Howard, you had a very long, very successful career. Is there anything that you think that you would have done differently, or wish you had done differently?
Well, I can't really pinpoint anything specifically. I was fortunate in that I had good help. I think that's probably one of the important factors, to have that great lady at the front desk, have good assistance, and probably that's one of the most important things is working with good people.
Yeah, that's good.
Do you ever regret selling your practice to Ryder?
It worked out well. I had a great relationship with a lot of old-time families and patients, and turning them over to Ryder made it a lot easier.
That's good. Yeah,
that was
making me nervous, Troy.
The more rewarding thing.
We when we got out of school, we contemplated going into practice together, but we just knew that we would never get any work done, so we pretty much had to split up.
Just be goofing off all the time.
Yeah,
it's been great. And for the longest time, probably 10 years, Howard would work about a day and a half or 2 days, and I'd work another 2 days, 2.5 days. And man, it's working 4 days a week now is just terrible compared to that. Yeah. So I was happy with the arrangement myself.
Yeah, we had a good team.
Yeah, it's been
That's awesome.
I would, like I said, when I saw that broken off tooth, I thought, I wonder if Howard's still licensed, and if I can get him to come up here and do a 12 surface amalgam on this 31, because I don't know if I'm going to get it to stay. I don't know. So Howard, I want to ask you, and what brought up this thought is that Troy had a denture patient this week. Troy, I think you said that you delivered the denture, and then the lady said the next day that it doesn't fit, she can't eat anything. Was that just this week that happened, wasn't it?
That was yes. Well, I had delivered at the end of last week. Saw her again Monday, and grateful that my associate was able to see her again today. So, yeah.
I wanted to ask you, Howard had told me a story a long time ago about a patient that had some dentures, wasn't happy. And do you know the story I'm talking about, Howard?
I have so many denture stories. Something in dental school that stuck in my mind was one of the professors in the denture department. He said, boys, restorative dentistry will put bread on your table, but dentures will put a Cadillac in your garage.
Is that right? Wow.
That's why I always drove a beat up pickup truck.
There you go.
Yeah.
I pretty much retired. I told my business partners the other day, I says, hey, I'm done. I'm done with dentures. I can't take them anymore. I spend so much time trying to explain to people what it's going to be like, transitioning either from a dentulous to an edentulous scenario, or going from an older denture that's severely worn with no teeth in the posterior to teeth that have anatomy and things like this. And it doesn't matter how much you talk to them, they still complain, and it just drives me crazy. And when I heard today that my business partner had to deal with that lady, I was feeling like, oh no. And I'm just like, today I'm done. I have made the decision. I will no longer do dentures.
They can be rewarding, as you know. On occasion, you'll have some very happy, satisfied, good-looking patients. But we had several different cases over the years that were really memorable. that guy I told you about, that was a professor in the dentistry department. He said, "Boys, you'll have those patients. We used to call them dental birds because they were perched on your doorstep every morning." And this guy writers are referring to was perched on my doorstep one too many days.
Yeah.
So he came back in before we saw any patients that morning, and I had just had it with him. I'd been over backwards, and I couldn't please him.
Yeah.
And I only dismissed 3 patients out of my 42 years of practicing, and he was one of them. But anyway, he comes back and he just going on and on and on. So I sat down and I sat him right in front of me, and I said, "Let me see those." So he takes them out. I put them in my hand. I opened the trash door. I said, "Pick up a check on the way out." He was out the door, and anyway, that was
great.
one of many.
That's great.
A couple of other things on dentures that stick in my mind. I had a lady that was pretty fearful of her husband. This guy's name was Hugh DeVries, a big old Norwegian type guy.
Huh.
And she was a little tiny frail gal. She came in one morning and had her denture in her hand. What was left of it, there must have been 10 pieces. She said, "Doc, Hugh's gonna kill me. Fluffy chewed my denture last night." I put my denture on the dresser and the dog got it overnight. And if Hugh finds out, he's gonna shoot the dog and me both. Can you get these fixed for me today?
Oh
I
boy.
said, well, that's pretty much impossible, but I think we had her some new ones in just a few days.
Yeah. Wow. That's great.
There was another one that was interesting. This gal used to come in for years. Her whole family did. She had a maxillary denture, and her hobby was catching night crawlers for fishing. So she was out catching night crawlers one night, and she tripped over a log and fell head over tea kettles, and her flashlight went out. She couldn't find them groping around in the dark. So she comes in the next morning. She says, "Doc, you won't believe what happened." She said, "I lost my dentures last night catching night crawlers, and I went out this morning and the farmer had just plowed the field where I lost them."
Oh no. Oh.
We had to go in warp speed making her some new dentures.
Wow. That's awesome.
Anyway, there were several others, but those were quite memorable.
And I hope after our career's over, we can look back on these with fondness, because when you're in the middle of that, I think it would be quite stressful.
Yeah. If you could have been anything else other than a dentist, Howard, is there some profession, some vocation that you think, that would have been fun. I would have enjoyed that, I think.
I was lucky enough when I was going through college to have a roommate that took me to Alaska, and we were actually game wardens at 19 for the summer. And I went back and did that 3 summers in a row. And Alan Crane, the fellow that took me and my partner up there, he stayed in Alaska and became a full-fledged, full-time game warden.
Wow.
And started flying for the fish and game.
Wow.
And then he transferred over and flew for the U.S. Fish and Wildlife Service. And we're still really good buddies, and I keep in touch with him, and he's done very well.
That's awesome.
He has a ranch in Arizona. He has property in Hawaii. They live in a house in the summer on the Kenai River. So
wow, that's rough.
I would say that would be something I would consider, but dentistry's treated me well.
Yeah.
It's supported all my bad habits. I wouldn't ever tell anyone not to get into it. Things are a lot tougher these days.
Yeah.
With insurance and PPOs and HMOs and everything, but it's a rewarding career.
Yeah.
It's good.
Yeah, insurance has really changed it. I've seen with some of the chart notes, some of the fees that Howard used to charge, and things have skyrocketed, but I'm not sure we make any more money nowadays because with the insurance write-offs and stuff, we're getting screwed out of a lot of money that way, guys. So anyway, we won't get into
big time
insurance thing all night. Troy, do you have any other questions for Howard?
I'm going to follow up. You said that dentistry supported all your bad habits. What are some of those? What are some of those hobbies? Some of those bad habits you used to unwind when you were done with work?
Turn it as hobby. I like that, Marcus.
I grew up with a father that was really enamored with the blood sports. So as early as I can remember, following him up the hill, hunting deer or out in the boat, gutting fish. And so hunting and fishing's been my fun things to do. We do a lot of that, and it's been rewarding. Been fortunate enough to go back to Alaska just about every summer.
Yeah, a lot.
I think for the first 4 years out of dental school, we were too poor to do anything. But
yeah.
We've been back a number of times, and dentistry's paid for that.
Yeah, that's great.
Yeah,
You feel that's an important thing to have those kind of things outside of dentistry to just kind of disconnect or unwind, or do you recommend finding something like that?
It's so stressful, as every dentist knows, and yet you have to leave it at the office and have some outlets for yourself. You have to be very selfish as far as protecting your own health, your own interests, and
that's a good way to put it.
It's something that you can't take home every night, as you guys will know.
Yeah, and we seem to. Let me just ask this question, Troy. I don't mean to cut you off, but so we've talked. Let's see, guys. We're almost 18 years into the 17 and a half years or something into this, and we talked quite a bit that at this point we feel like we'd probably be kind of cruising along, no stress and everything like that. But was there a time in your career, Howard, or maybe it never happened, that you just finally felt like this isn't quite as stressful? I've got this this career by the neck, and I can really handle this? Or was it just kind of stressful until you retired?
It's always there, the Monday or the Sunday night.
Yeah,
anxiety.
We get that all the time. We talk about that all the time.
That was always there, but you just have to recognize it and deal with it. I don't have any suggestions how to overcome it. Just recognize what it is, and try and deal with it and avoid it as best you can. But I don't think you ever outgrow it. It's just it's just part of the game.
Well, guys, there you go. We have no hope.
Yeah. So that's a great thing, because man, I mean, we talk about it. It just seems like it's getting worse and worse and worse, not better and better. And we've talked about, we've done these procedures thousands of times, and it just seems like you just always worry about it. You're always worrying about everything, anything from staff to patients to procedures to insurance companies. I mean, just like nonstop, always something. And it's like, we've always talked about, at some point we thought we'd go, okay, wait, and we've been in there a certain amount of years. This is, the way we feel. It's normal. It's going to taper off. We're just not going to worry. But we've kind of talked a little bit about the fact that we probably care so much that it just never will go away, because it's just not in our nature to just say, oh, I don't care anymore. We just care a lot about these people. We care about the work. We care about what they think of us. We care about what our staff thinks. We want them to be, fulfilled in their jobs. And it puts a tremendous amount of pressure on us as dentists to keep all that, together and not unravel it.
Well, it's a daily challenge, and just recognize it for what it is. Don't let it control you. It would be my suggestion as best you can. Have other outlets, stuff that you enjoy.
That's good.
Having friends like you guys to talk about it, I think helps.
Yeah.
Everyone goes through the same thing.
Yeah.
And the fact that you guys are close enough, you can share your concerns and help each other out. I think that's a big help.
Yeah. Yeah, that's good. And that, I mean, we've talked about that a lot, the Sunday night anxiety. So that's interesting to hear from somebody that's done it for so long that's still got that anxiety. Did that go away like right after you retired, or did it take a minute for you to realize you didn't have to go to work on Monday morning?
It was 7 minutes.
Oh.
It took quite a while to realize and to tell myself that, you don't have to think about it. You don't have to, do all the things that you've done for that many years. It's okay to relax.
Yeah.
And it's okay to do this and that.
Yeah, that's great.
Looking back, I wouldn't trade it.
You wouldn't try something else?
I don't think I would.
Okay, that's good to know.
It's very rewarding.
Yeah. I want to ask you about the escaped convict that got out the bathroom window at your office one time. I mean, I've kind of, you've told me the story, but I think Marcus and Troy and the other listeners would probably really enjoy this story.
Well, back in the day, we used to do quite a few prisoners from the county jail, and this particular guy, I was familiar with his family, and I knew him. He's long gone. I guess I can call him by name. Anyway, he comes in with shackles and handcuffs and his orange jumpsuit, and the deputy was right there, and he said, "Doc, we got to get this guy out of pain. He's really hurting." So he comes back in. Sure enough, he had a real big old abscess tooth, and anyway, it was legitimate that he was there. Anyway, I numbed him up, and he said, "Oh my gosh, Doc," he said, I'm so sick to my stomach. He said, "I'm afraid I'm going to throw up in your chair." I said, "Okay, well, let's just get you down the hall, and here's the bathroom." Yeah. So the deputy and I walk out in the hall, and we're sitting there talking, and this guy puts on an audio you would not believe, as far as making you believe that he was sick and in the bathroom throwing up.
Oh my gosh.
And this went on for a few minutes, and the deputy and I are looking at each other. Pretty soon it's quiet, and the deputy, all of a sudden, he goes running down the hall and jumped in his car, and he splits out the driveway. And what the heck's going on? But Jim had gotten into the bathroom, and while he was doing this audio, somehow he got the window open. He jumped out the window, and there were tracks in the snow heading west. Jim was on the loose for about 3 months.
Oh my gosh.
Wow.
They finally caught him in the attic of one of his relatives out behind the office about a block away.
Oh my gosh.
But he was free for a while.
That's fun. Okay, I hadn't heard the end of that. They've been out for 3 months. That's good. That's funny.
Yeah, the dental office is an escape tool.
Is excellent. I wonder if his tooth got feeling better after that. Man,
I never saw him again. I don't know what happened.
Well, you guys have any questions to finish off with Howard here?
No, it's interesting just to kind of see how things have changed over the years, and some things have changed, some things haven't. I guess we're still working on teeth and some of the same stuff, the new technologies, of course, but of course those come with a cost. what are you seeing as far as, the new technologies, the cone beams, the $60,000, $70,000 cone beams, the $140,000 mills, and that kind of stuff. Have you seen any of that have you really wish you would have got into that stuff, or are you pretty much okay with just the way things tidied up with you in your career?
It was satisfactory, doing the things that we did back in the day, just having a routine dental lab and,
Yep.
all the new techniques are well and good, but they're costly, like you guys are saying, and
Yeah.
I don't know if the end result is worth the investment. It might be for some people, but it just depends on each individual, and keep the cost factor under control, and get your return to investment lined up.
Yep.
and decide whether to spring for that kind of equipment.
Yep, we talk about that all the time, and
Yeah.
Marcus has done a little bit of that. I have done none of that. Troy, you don't have like a Sarek or anything, do you?
No.
You just drive a Lamborghini, though. You put your money into that, right?
Yeah, I have so many exotic cars, and I park them in the garage of my 1,600 square foot house.
Cracker Jack Bob's house.
Yes.
Oh, well, Marcus, do you have any other final question for Howard?
I don't. This has been a great interview. Great talking with you, Howard. It's really fun to hear about somebody who's lived through it, what we're in the middle of going through, and what our listeners are starting on and going through. So we really appreciate you taking the time to do this.
Marcus and Troy, enjoyed talking to you. It's been great to hear from you guys and see what you're dealing with and see the changes that have taken place over that many years.
Yep.
I think the biggest reward that I can think of is dealing with the people. I was fortunate enough to have great patients, and I've handed them over to Ryder, and he's taken great care of them. But I had one family. I was fortunate enough to be their dentist for 5 generations.
Yeah, I remember that.
And I had
Wow.
3 or 4 other families that were 4 generations, and the fact that they would consider sending their dentist an invitation to their son's wedding or graduation or something like that, I considered that an honor.
Yeah, that's cool.
And
Yeah.
the fact that if you show up to a funeral or send your patients a card when they lose a loved one, that goes a long ways to show the appreciation for the patients, and the fact that it goes both ways.
Yeah.
You're dealing with people, and everyone's got an interesting story.
Yeah, that's true.
That's true. Very true.
I tried to find out something about every patient that I worked on, and the gals would come back. Okay, doc, let's go to work. Quit the BS
Quit
session.
chatting.
Yeah.
Chat. We got to do some dentistry here.
Anyway,
That's
it's fun
good.
to work on
That's good.
on teeth, but it's funner to work with people.
Yeah, that's good.
Yeah.
Yep, I'd agree with that. So, well, Howard, we really appreciate this because I feel better. I feel like we can survive this career now, guys. And I mean, it's nice to have somebody with a little perspective that's not right in the middle of things, and still gone through the same stresses as we have and everything like that, and made it out alive. So, Howard, we really appreciate you being with us tonight.
Thanks, guys.
This has
Great to
been
talk with
really
you.
Great.
Yeah, thank you
This
very
has
much.
Yeah, and thanks everybody for listening. Marcus, do you want to tell everybody where they can get in contact with us or follow us and everything else?
Yeah, if you want to get in contact, just send us an email at dentalrealist@gmail.com. We'd love to hear any questions you have, any feedback that you have for us. You can find us all over social media at Dental Realist on Twitter. We've got Facebook. We've got a couple of books you can look into if you want to read a little bit more. So now you're a dentist, and so you want to be a dentist. Anyway, a lot of different ways to be in touch with us.
Yep, and we appreciate everybody listening. This has been episode 53 of the Dental Realist Podcast, and we'll talk to you on episode 54. Thanks a lot.